Hi, I'm Dan Merrick. I'm a pathologist at the University of Colorado, and I study lung cancer and specifically premalignant lesions of the lung. So I think probably first off, I should explain what DIPNECH is. It stands for diffuse idiopathic neuroendocrine cell hyperplasia. The hyperplasias are the premalignant lesions that can go on to form neuroendocrine tumors, and premalignant lesions have been our focus for quite some time. The diffuse part indicates that it's kind of throughout the lungs, and the idiopathic part indicates that we don't know what causes it. And so that's really the focus of this particular project. We're going to look for possible presence of an acquired mutation that actually ends up leading to this disease. And so we want to understand what causes the progression of the premalignant lesions to the neuroendocrine tumors. And then we want to understand this is a subset of neuroendocrine tumor patients. And so we want to compare it to the patients who don't have DIPNECH that have neuroendocrine tumors, so we can understand the underlying causes for neuroendocrine tumors in both these populations. I think an important novel aspect for our project is that we're going to look at the entire expressed portion of the human genome by a technique called whole exome sequencing. I think if we were going to use an analogy, if you were looking for a culprit in a large apartment building, using whole exome sequencing, we can look at every single apartment, whereas limitations, especially related to the size of these premalignant lesions, other studies might only be able to look at 3 or 4 apartments. We believe that there's going to be some underlying mutation that leads to the development of these premalignant lesions and eventually the invasive tumors. And by identifying that, we think we'll likely find a driver mutation. And as with other lung cancers, when we find a driver mutation, frequently we can develop some sort of targeted agent that can actually treat those tumors. And so that's a major goal here. I think, I also mentioned that we are focusing on the premalignant lesions also. And while certain developments in lung cancer for targeted agents have been pretty impressive, say in treating adenocarcinoma, they've only led to maybe a 5 or 6% increase in 5-year survival. Whereas preventing lung cancer or other cancers can lead to dramatic improvements, like 20 to 60% reductions in mortality. And so by finding a driver mutation, we could also actually apply targeted agents in prevention applications to prevent the neuroendocrine tumors. But these patients with DIPNECH also have severe respiratory compromise that can end up leading to life-threatening situations. We may be able to prevent that from occurring also. This Investigator Award for us is really huge because it's a pretty significant amount of money, and we really think we need to do this whole exome sequencing to understand what's going on, and furthermore to study several different lesions. And so the whole exome sequencing is pretty expensive, and this really should help us, or is really the only way we can achieve this. So I think sort of to wrap it up, I think 3 or 4 things. I think a lot of times, a lot of the donors may be patients themselves or know somebody, and the patients are so important. It always amazes me how willing patients are to consent to have their tissues studied, which is of course absolutely necessary for us to learn anything. And then for donors in general, I'm always impressed by the dedication and the foresight that they have. The research process sometimes can take a while, and not everybody understands that is valuable. And I think the NETRF funds here in the whole program are such a blessing for us, and we really appreciate the opportunity to use these funds for these types of studies.